All right, let's dive right into this explainer. Today, we're going to completely shift how you view your next visit to the doctor. We're going to look at healthcare through the fascinating lens of anthropology, breaking down some incredibly eye-opening source material that challenges the very foundations of modern medicine. As you'll see, healing isn't just about biology. It is deeply tied to culture, society, and the human experience.
To kick things off today, I want to ask you a deceptively simple question that honestly challenges everything we think we know. What does it actually mean to be sick? Just really think about it for a second. Is sickness just a virus invading your cells? Or is it that awful feeling when you physically can't get out of bed? Or maybe, is it how your community treats you when you have to call out of work? Keep that question in the back of your mind as we unpack all of this.
Section 1. Beyond the physical body.
For literally centuries, we've basically separated the mind from the flesh. Our source material points right back to the philosopher René Descartes, who famously split human reality into two completely distinct parts. On one hand, you have the res cogitans, that's our thinking, conscious mind, and on the other, the res extensa, our physical, material body. Because of this split, known as Cartesian dualism, modern medicine has historically treated the sick body like it's just a broken machine. We look for the faulty gear, we try to fix the broken part, but we often completely ignore the personal, subjective experience of the actual person living inside that body.
And this is exactly where medical anthropology steps in to change the game. This is a specialized science that looks at patients not just as biological entities to be fixed, but as complex social beings deeply rooted in their culture. It's a powerful reminder that every single time a patient walks into a clinic, they're bringing their entire cultural background, their belief systems, and their social environment right into the exam room with them. Human beings are always a work of progress, and our health is totally intertwined with that reality.
Section 2. The clash of two medicines. So, zooming out a bit, we essentially have two very different healing systems interacting in the world today. On one side, there's objective biomedicine. This is the official academic medicine most of us are familiar with. It looks for physical agents, like bacteria, it relies heavily on objective lab tests, and it attacks problems with chemical treatments. But on the flip side, we have ethnomedicine, or traditional medicine. In this system, the root cause of an illness is often seen as a rupture in social harmony. Diagnoses are way more subjective, focusing on the patient's inner world, and treatments might actually involve cultural rites to restore that lost balance. Both systems are absolutely trying to heal people, but they speak entirely different languages.
Which brings us to a huge challenge. How do we bridge this massive gap between clinical doctors and patients from diverse backgrounds? Well, our sources offer a really elegant solution, called positive interculturality. Basically, this means the medical system needs to embrace cultural differences without forcing a patient to lose their identity. It requires acknowledging what anthropologists call alterity, which is just a fancy word for the otherness of different cultures, and genuinely learning from them. Because if we don't do this, we risk falling into fundamentalism, where a dominant medical culture just rejects the patient's beliefs outright. Or worse, alienation, where a patient is forced to abandon who they are just to get basic medical care.
Section 3. The three faces of getting sick.
Now, this next part is a real light bulb moment. Medical anthropology makes a massive distinction between three terms that we normally just mix up in everyday conversation. First up is disease. This is the clinical, organic process that a doctor looks for. It's the objective stuff, like a lab result. Second, there's illness. This is your subjective experience, how you personally feel the pain or the exhaustion. And third, there's sickness, which is the social perception. It's how society views your condition, the stigma that might be attached to it, or whether your boss even believes you enough to let you take time off. It's wild to think about, but you can literally have a biological disease, like high blood pressure, without feeling any illness. Or you can feel a terrible illness without a doctor being able to find the biological disease.
Section 4. The triangle of health.
Health doesn't just happen in a vacuum, right? There is a deeply interconnected triangle linking medicine, society, and the individual. Think about it. An individual experiencing an illness only officially becomes a patient when a doctor or therapist actively accepts them into their care. And that doctor? They are only recognized as a healer because society has granted them that professional status. At the end of the day, it is society that sets the rules, controls the funding, and decides who gets access to that entire medical relationship.
But here's the catch. That triangle, it is incredibly fragile. Socioeconomic inequalities and cultural prejudices can completely break this system down. Our sources highlight that when a doctor and a patient don't share the same language or cultural worldview, you get massive communication blocks. The patient might be terrified of the treatment, and the doctor might totally dismiss the patient's concerns. And this is exactly why the text argues that medical curriculums have to evolve. Future doctors need to be trained not just in human anatomy, but in the specific cultural and linguistic realities of the communities they are actually serving.
Section 5. The Art of the Medical Act.
So, taking all of this into account, we reach the medical act itself, that moment where rigid science has to gracefully merge with deep humanism. The true art of medicine actually rests on 5 core moral values. It starts with vocation, that inner voice driving the physician to help. Then comes integrality, which means developing fully as a well-rounded person, not just a clinician. Next is intellect, the human capacity to analyze and make nuanced judgments that a machine just can't replicate. Then humanism, treating the patient as a complex human being, not a biological puzzle to solve. And finally, solidarity, truly standing with the patient at their level. It proves that a great doctor isn't just a mechanic for the body, they are a solidary humanist.
So what does this actually look like in the clinic? Well, treating a patient is described as a beautifully structured 4-step process. Step 1 is profound empathy, that very first look where the doctor tries to understand the person beyond their own biases. Step 2 is holistic exploration. This isn't just checking vital signs. It's diving into their environment and their life story. Step 3 is the ethical phase, carefully executing procedures to reach a diagnosis that is both accurate and just. And finally, the operative phase. This isn't just tossing a prescription across a desk. It's actively collaborating on a treatment plan with the patient's full, informed consent. I want to leave you with this incredibly moving quote from our source material to reflect on before your next clinic visit. The true mission of a good doctor is to cure sometimes, relieve often, and console always. Medicine won't always be able to defeat biology, but it can absolutely always offer human connection. So the next time you're sitting in a waiting room, ask yourself, is your doctor just looking for the biological disease, or are they ready to treat your illness and truly understand your sickness? And perhaps more importantly, are we building a society that actually allows them to do both? Thanks for joining me on this explainer, and I hope this completely changes how you view the art and science of healing.